Hello everyone, my name is Shayna White. Welcome to this presentation today about advanced directives and why it is a healthcare concern. So thank you physicians, advanced practice nurses, and staff nurses here at the hospital for coming to this presentation. Today we're going to talk about why the advanced directives are a concern for our facility, who it affects, and what can be done to solve this. So what exactly is the issue? Basically, patients are living longer. They were once diagnosed with terminal illnesses and that was the end of it, but now because of medical science and advances, we are at a point where end-of-life decision-making has become such a crucial part, especially in the acute care setting. So we basically have a lack of education with both providers and the public. There's sometimes barriers with the patients not wanting to talk about end-of-life issues, physicians not wanting to talk about end-of-life issues. There's also legal and ethical issues. Physicians sometimes are put in predicaments where a patient has an advanced directive, a DNR wish, and a family wants to override it. So what is a physician supposed to do? Let the patient die because that is their wish, or risk facing a legal suit from a family member that wanted to override it because they let them die? So all of this kind of creates a whole bunch of issues that essentially have turned into advanced directives are either not being filled out correctly, or there's a lot of legal issues about whether they're filled out correctly, when they can be implemented, when they're not allowed to be implemented, is it okay to go from state to state, etc., etc. So because of this, we need to start looking at some solutions. Within our hospital, I'd really like to look at our advanced directive forms on admission. So it's federally mandated that we give everybody an advanced directive option when they get admitted to the hospital, but only 18 to 31% of people are actually filling them out. So I think a big thing that we can do at our hospital is appoint a designated person to be an advanced directive specialist here at the hospital on intake, so that patients can talk through with an expert that can actually sit down and go through all of their options and the form and make sure that everything's clear, not confusing, answer any questions, instead of just handing them a paper by an untrained person, and then they just look at it and just sign, no, I don't want to deal with it, and that's the end of it. And that's part of the reason why I think these forms aren't being filled out. I'd also like to implement some continuing education classes here at the hospital where all of the nurses, advanced practice nurses, and physicians can go and get some clarity on the legality of what they can and cannot do, what we have specifically at our state as far as advanced directives, and then I think it'll kind of help clear the waters a little bit on what they're allowed to do at the bedside. And I'd also like to partner with local nursing schools. So I'd like the education department here, the nurse educators, since they've already got that partnership with the nursing schools, to reach out and talk to them about possibly looking into whether they have advanced directives as part of their ethics courses, for example, and whether they look specifically into what we do here in our state. Because I think that if they get a little bit of exposure to that in nursing school before they come work for us at the hospital, it'll help give them that foundation before they get here and they start taking these classes as well. In the community, I would also really like to start outreaching whenever we do events like blood drives and blood pressures and blood sugar checks. Also have the advanced directive person or a physician that wants to volunteer to come to these events as well as specifically an advanced directive person. So after they get done getting their blood pressure checked, hey, have you filled out your advanced directives? Do you have a living will? Do you have any of this stuff? Because I have somebody here that you can talk to and possibly fill out a form if you're interested. And I think it'll get people more interested in the community in taking advantage of their end-of-life choices. And then also talking with the clinics about distributing some pamphlets with end-of-life and advanced directive things, and setting up classes. This would be obviously, once again, a physician, advanced practice nurse, staff nurse, someone with expertise in advanced directives to kind of walk people through the process, give them the information they need and help them right then and there to fill these out. And we can do these either at the clinics or with the local libraries whenever they have their classes as well. But ultimately, big picture outside of our hospital, a standardized form is the ideal thing that we could do to make sure that there isn't all of this back and forth about what we're allowed to do, what we're allowed to accept, can it go from state to state. That's causing a lot of these issues with whether we honor advanced directives or not. So unfortunately, all of these states listed here, Alabama being one of them, is we're unable to have a standardized form because of the language that is in our laws. So we have to have in the state of Alabama a specific Alabama Advanced Directive form, and that is preventing us from being able to have a standardized form. So wouldn't it be nice if every single hospital, every single facility across the entire nation had one single form that was simplified, that everybody knew was ironclad? If a patient puts their wishes upon this, then that is what we are doing. There is no murky water, what we can or cannot do. And this would be something that we would have to start kind of lobbying, talking to our nurses, talking to the physicians, start talking to people about getting a hold of your representatives and asking them what we can do to move forward, changing some of the language with these laws, because ultimately I think that standardized forms would be the best way to deal with this issue. But on the smaller scale at our hospital, I'd like to start with educating both our staff and our community as well. And then together we can improve end-of-life decision making. Thank you.